Good afternoon, everyone. Thanks so much for joining me today. I'm Jenny Montgomery. We have a powerful show for you today. We're going to meet Brennan Francois, who is a very dynamic speaker. He's going to talk to us about empowerment and what it means to you. He has a new book called Hang in There, and he's going to tell you why it's important and what we gain when we suffer through something and we stick it out and we come out on the other side. Also, we're going to hear from Patrick Smith about elder law. This is really important if you are dealing with aging parents and some of the legal situations that you need to make sure you have in place, and estate planning. And these are things that you'll also find out about at WJBF's upcoming Caring for Aging Parents Expo. But I'll tell you more about that in just a little bit. First, though, as you know, throughout the month of October, we have been talking about breast cancer. You know the statistics. 1 in 8 women will be diagnosed with the disease. Breast cancer is the second most prevalent cancer among women in the U.S., but millions are surviving the disease thanks in part to regular screening and new technology. With the millions of dollars in donations for breast cancer every year, the ability to discover cancer and care for patients has improved dramatically. Research has led to many improvements. One example of that is a switch from 2-dimensional to 3-dimensional mammography several years ago. It helps doctors take a closer look at the breast. Technology is constantly changing to increase breast cancer survival rates.
One thing that we have now that we didn't have in the past are much more advancements in our imaging techniques. So we get a better sense of exactly how large the tumor is. And so then we can safely say we can take a certain amount of tissue and be sure that we've gotten everything with clear margins.
Dr. Alicia Vinyard is with me now. She is a breast surgical oncologist at Augusta University Cancer Center. And Dr. Vinyard is also a breast cancer survivor. Thank you so much for being here today.
Thank you for having me.
You know, you were telling me just a little while ago that you were in your last year of medical school. You were all excited for your future, for your career, and you felt a lump.
Yeah, I was about towards the end of my medical degree, and I felt a lump, and it was actually painful, which most breast cancers are not painful. This one was bothering me, so I decided to have it looked at. I ended up getting a mammogram and ultrasound, and they actually said it looked benign and to come back in 6 months.
Oh,
I was 25 years old and I had no risk factors, so it wasn't a very alarming finding. So I ended up just deciding to have it removed anyway because it was actually painful. And then I got a phone call from a breast surgeon 3 days later that it was invasive ductal carcinoma, that there were positive margins, they would need to go back to surgery, and then they would also check my lymph nodes as well.
How did you feel being a patient and having so much medical knowledge yourself?
It was scary, but also calming. I felt like I had a lot of resources. I felt like I had people I could call and make sure that I was getting the best treatment possible.
I guess you were sort of a living lab for your classmates.
They were all very surprised, and no one expected it. Everyone was very shocked by the news. I have a very female-dominated family. No one has breast cancer in my family. I have no medical problems. I literally have no risk factors for the disease, so it was just very strange in itself. And but it just showed to be proactive when you know something's wrong with your body.
It's amazing to look at you now and think that you went through all that you did, that you lost all of your hair.
Yep.
But now you're back and you're a surgeon. And what other changes happened in your body? Does it affect your fertility?
Yes, so it is a small percentage, but it is a possibility that after you undergo chemotherapy, you can become infertile. And I had actually found out this information through the Young Survival Coalition website. It's for young women who've been diagnosed with cancer. And I actually brought it up to my medical oncologist about could my fertility potentially be affected. And they said, you know, it's a very small percentage, but I said, it was a 1% chance that any woman less than the age of 30 should have breast cancer. So I was
you were used to small percentages.
I was not gonna take any chances. I actually did have my eggs frozen before chemo just to be sure. And it is very shocking, but there are only 15 states in the United States that provide any sort of insurance coverage for fertility preservation, and even in cancer patients. So it's something I'm passionate about in that regard too, just that you've been diagnosed with at a young age with breast cancer. There's a potential you could, not be able to have a family, and that shouldn't be something you should stress about at that time. It should be taken care of for you. So.
Absolutely. So going through this has made you aware of other issues that you might not have gotten from a textbook.
Of course, for sure. And it's, just reading about these medications and chemo and radiation, what does that mean? I mean, I know what it means now. And so when I explain to a patient that they have breast cancer and I explain the different treatment modalities they're going to experience, it's great that I literally explain to them exactly how it's going to go.
It must make your patients trust you so much.
I think so. I think, I don't always tell every patient that I have had breast cancer. Sometimes it's the certain patients that I feel like they need to know so that they know I've been there and I can empathize and that you're going to be okay. And I think it always helped me to see another survivor who had been through it. And so when I do tell them, it's kind of a calm sense of ease, and I feel like they trust that I'm going to do what's best for them.
That also says a lot to me about your perception. You don't see yourself as, first of all, a breast cancer patient.
No.
That's not how you define yourself.
No, I mean, I've always wanted to be a doctor my whole life, and then I decided to be a surgeon. And, just being able to go in and just take something out and make someone cancer-free is so gratifying and rewarding to me, and I feel like that's just what I was put on this earth to do. So,
Alicia, your story is fascinating. I know that you're going to touch a lot of people who are watching. Thank you for being so frank with us and for telling us about it. I think that in this last minute that we have, I would just really like you to speak to the young women out there about the importance of breast self-examination.
Yeah, I think it's very important that you pick a day each month, and I say this, I sound like a broken record, but pick one day every month and stick to that day, and that's your self-breast exam day. Maybe put it in your iPhone as a reminder, because after you do this every month, you will learn your breasts. You don't have to be a doctor to find an abnormality. And then if you do find something that's wrong, you'll be able to have it looked at and get it caught early, because the earlier you catch it, we're approaching a 98-99% survival rate. So check your breasts, do it diligently every month the same time, because there can be fluctuations in your tissue with hormones. So if you pick the same day, you'll be about the same level each month. And that way, if you find something, you can catch it early. So.
Great advice, life-saving advice from Dr. Alicia Vinyard. I encourage you to seek her out if you are needing a surgeon, a breast oncologist. How do we say it? Breast surgical oncologist.
Correct.
I hope that you don't need that, but if you do, this is someone who can really speak to you about it. Thanks a lot for what you do in our community. Good luck to you.
Thank you.
We'll be right back.